Hello, it's another episode. We have another colleague, Dr. Vivek Sharma, who has joined us about more than a year now. Within the year, he just confirmed that he's one of the best surgeons in the UAE. As I mentioned before, we are a complete team. I cover ear diseases, hearing solution. We make a center of excellence center for hearing solution, either the ear operation, cochlear implant, all these things. But the advantage of Al-Zahra department, ENT department, that has all the subspecialty. Otology, pediatric otolaryngology, rhinology, skull base, we do rhinoplasty a lot, and head and neck. We are lucky to have Dr. Vivek with us, and he covers many things we the other three did not cover it. He's going to talk about the service he added to our hospital to make our team, perfect team, whatever you have a problem, sort it out with high experience, high quality of service. Please go ahead, Dr. Vivek. Yeah.
Thank you, Dr. Jamal, for kind introduction of mine. My name is Dr. Vivek Sharma, and I have been practicing ENT since last 20 years. I have joined Al-Zahra 1.5 years back. I would like to introduce my specialities, which I'm very keen to do. First thing, I'm a very good surgeon for head and neck surgeries. I'm specialized in all kinds of head and neck surgery, included like thyroid cancers, benign thyroid tumors, or a parotid tumor, or any tumor or any swelling in the neck. I'm very happy to deal it and help the patients recover about it. My second area of interest, I would like to say that it's a pediatric ENT in which we see a lot of snoring in children.
Yes.
And for that, we do very advanced surgeries here. Like we have a coblation machine, and the coblation is one thing which cut and coagulate at the same time.
Yes.
So there is hardly any blood loss, and the children recover very fast. And not like the conventional old methods, we use endoscopes to visualize the adenoids so that we have a complete 360-degree removal of adenoids so that there is no chance of recurrence. We don't say that there are any chance of any more recurrence. Like same way we do tonsils, and we under microscopic guidance, we do even a tonsillectomy.
Yeah.
So we see the post-op recovery is very fast in children, and there is hardly any pain or any blood loss for these children.
I'll interrupt a lot, just a bit. I observed one of your surgery. I must say, one of the best adenotonsillectomy I have ever seen in my life. I've done a lot, I've seen a lot, but the thing with Dr. Vivek technique, he does the tonsillectomy under microscope. Therefore, even any tiny vessel, he could see it and stop the bleeding from that vessel. Almost is a almost no blood loss at all at the end of the surgery. We can't say zero, it's maximum 5-10 mil. Usually they bleed about 50 mil in this surgery. With his technique, 5 to 10 mil maximum if it's not zero. Doing the tonsil with the microscope and doing the adenoids with the endoscope inside the nose, he will be able to shave all the adenoids. We've seen a lot of cases, they've done adenoids after 1 year and they come back. Because if the adenoid is coming to the nose, at the back of the nose, very hard to remove it by routine way, which is the curate. While he with the endoscope through the nose, therefore he will be able to clean it, and I think the recurrence rate in his hand almost zero. Please go ahead, yeah.
Yeah, I would like to add on again few things. Like I'm very keen in doing advanced endoscopic sinus surgeries, like a recurrence of polyps, recurrence of allergic sinusitis, allergic fungal sinusitis, which are hidden in the maxillary sinus floor, anterior areas, which cannot be reached with the 0-degree endoscope. So we have 45-degree angle endoscope, 70-degree angle endoscope, where we can reach every nook and corner of the maxillary sinus, or are hidden in the frontal sinus, frontal recess, which is a bit complicated to do. But as you said previously, we have navigation machine.
Yes.
So that helps us a lot, and we can deal with complicated sinus surgeries as well, and a revision surgeries, which I think a lot of ENT surgeons in other places other than Al-Zahra are not doing it. And Al-Zahra is one place where you have all the services of ENT under one belt. You know, we cover everything in our department.
Yeah, and because allergic rhinitis is very, very common in UAE, therefore having experienced surgeon like you are, able, or you are able to solve any problem with the sinuses. Particularly in India, they have a special or higher experience in dealing with the fungal sinusitis because you have many cases there. I observe you surgery. You're doing perfectly safe surgery. Having the navigation, Al Zahra Hospital will help with the revision cases. You don't need for simple case, but you need it for the revision because the anatomy is disturbed. Therefore, it will be very critical, high eradication of the disease and low complication rate. If it's not zero, I don't think we have any complication for the last 5-6 years in all our department, which is very rare. I've been somewhere else, and I've been in the panel who will deal with a complication from other places. I'm proud. Al Zahra Hospital, I've been here for 7 years. We have no complication at all because of the high expert, good equipment, very nice and good, tidy, clean, sterile place. Then that approach, high success rate and high quality for the safest for our patient. I've seen head and neck. Not many people doing head and neck perfectly. I'm watching you do some surgery, done the perfect job. You are very good at it for our department. At the end, I think people who are observing the 3 episodes, they realize that we are a complete team. I just add one thing. We are open-minded. I knew 3 places, everyone works separately. No, we are a team. If there is a difficult case, we discuss with each other. We go to visit our clinics other. Therefore, as a team, we are open-minded to another opinion, particularly with difficult cases. For that will go for the best benefit for the patient. Our patient is our main goal. Cure, be happy. Then I think at the end, the ENT department, not only the hearing solution, the hearing department, it will be the center of excellence to provide the best service to our patient.